Okay, welcome back to the deep dive. If you're prepping for the MSRA, well, you know some conditions pop up again and again. This is definitely one of those. Today, we're diving into a really common, sometimes a bit annoying skin condition, Pityriasis Versicolor. You might also know it as Tinea Versicolor.
That's right. And the aim here really is to pull out all the key high-yield stuff you need to know. Think of it as your fast-track guide to understanding pityriasis versicolor, what causes it, how you spot it, and crucially, how you manage it. It's a fungal skin infection, often caused by something that, well, it just lives normally on our skin most of the time. But sometimes things change and it causes these, characteristic discolored patches.
Perfect. So let's dive right in. At the most sort of basic level, what exactly is Pityriasis Versicolor?
Okay, so fundamentally, it's a superficial fungal infection of the skin. The main culprit, the one we usually talk about, is a yeast called Malassezia furfur.
Hmm.
And yeah, people do call it Tinea Versicolor, but actually Tinea usually refers to infections by dermatophytes, like ringworm fungi. This isn't one of those. Malassezia is technically a yeast.
Oh, interesting. So it's a yeast issue, not like a classic fungal ringworm type thing.
Exactly. And what you actually see are these small, often slightly flaky patches on the skin that are, well, discolored. They tend to appear most often on the trunk, but you also see them on the neck and upper arms.
Right. And you mentioned it's an overgrowth of something that's normally there. How does that happen? How does a normal resident suddenly cause a problem?
Yeah, good question. So Malassezia species, M. furfur included, they're actually lipophilic yeasts, meaning they love oily environments. They're just a normal part of our skin's microflora, living quite happily, especially in areas with lots of oil glands, sebaceous glands. Pityriasis versicolor happens when something kind of throws off that balance, causing this yeast to just grow too much.
It's like the skin's little ecosystem gets disrupted, and this one particular resident decides to throw a massive party it wasn't really invited to.
That's a great way to put it, yeah. And while we often focus on M. furfur, other Malassezia species like M. globosa and M. sympodialis, they can also be involved in this overgrowth situation.
Okay, got it. So an overgrowth of this specific yeast, which leads us nicely to, well, why? What actually causes that overgrowth? What are the triggers?
Right, the etiology. Environment is huge here. Warm, humid climates, that's prime territory for Malassezia to really thrive. Increased sweating is definitely a factor, provides that perfect warm, moist environment the yeast just loves. Oily skin, like we said, because they're lipophilic, gives them more fuel. Hormonal changes can play a role too, like puberty, pregnancy, times when sebum production might increase. And significantly, anything that weakens the immune system can make someone more susceptible. A healthy immune system usually helps keep the yeast levels in check.
Okay, so pulling that together, who is most likely to actually get this? Are there specific risk factors we should know about?
Absolutely. Climate, as we touched on, is a really big one. People in tropical or subtropical areas, or even just during hot, sweaty summer months in temperate places, are at higher risk. Age is also key. It's much, much more common in teenagers and young adults.
And why that age group specifically?
Well, it links back to those hormonal changes around puberty increasing skin oiliness. It's actually pretty rare in young kids and in older adults, probably because of differences in their sebum production and maybe immune function too, other things. Having a family history suggests there might be some genetic predisposition.
Mhm.
Also, people with compromised immune systems, maybe they're on immunosuppressants or have a condition like HIV. Even things like wearing tight clothes that trap heat and sweat or malnutrition have been linked as potential risk factors.
That makes a lot of sense. It likes it warm, damp, and oily, and maybe if your body's defenses are a bit lowered. Okay, now this next part for me is where it gets really interesting for revision. How does this tiny yeast just sitting there actually cause those color changes? What's the pathophysiology?
Yeah, this is the clever or maybe annoying bit,
Mm.
depending on how you look at it. So Malassezia furfur, when it overgrows, it starts producing certain things, metabolites. Specifically, it makes these dicarboxylic acids like azelaic acid. And these chemicals, they actually interfere with the melanocytes. Those are the cells in your skin that make melanin, the pigment giving your skin its color.
So it's like the yeast is messing with your skin's natural color-making machinery, like throwing a spanner in the works.
Exactly. These acids inhibit a key enzyme called tyrosinase, which the melanocytes need to produce melanin. So in the areas where the yeast is overgrown, melanin production gets reduced.
Ah, okay, that explains the lighter patches.
Yeah.
But what about the patches that are sometimes pink or brown? How does that happen?
Right, so that's often thought to be due to a mild inflammatory reaction the yeast causes in the top layers of the skin. or sometimes it might be related to the fungal elements themselves building up. The name versicolor really fits because the color can vary so much. You get hypopigmented, lighter, hyperpigmented, darker, tan, brown, or even pinkish patches, and those lighter patches. They often become most obvious after sun exposure because the surrounding healthy skin tans, but the affected areas don't, making the contrast really stand out.
Right, got it. So we understand what it is, how it works, but okay, someone walks into the clinic, they've got some odd discolored patches. What else might be going on? This differential diagnosis list seems super important.
Oh, absolutely crucial. The look can definitely overlap with other things. You've got to consider vitiligo.
Yeah.
That causes complete pigment loss, stark white patches, usually sharp edges. No scale, no inflammation like you might see with pityriasis alba, often seen in kids, face especially. Lighter patches, maybe a bit scaly, but usually less distinct borders than vitiligo and not typically all over the trunk like this can be. Okay, what else? Tinea corporis, ringworm. That's another fungus, but a dermatophyte. Classic ring shape, raised red scaly border, maybe clearer in the middle. Looks quite different usually. Seborrheic dermatitis, also linked to Malassezia, interestingly, but looks different, more like red patches with greasy scales, often scalp, face, chest. They can sometimes coexist, though, which can muddy the waters. Pityriasis rosea usually starts with one larger herald patch, then smaller oval ones, often in that Christmas tree pattern on the back. Different scale, different distribution.
Keep going. This is useful.
Goutte psoriasis, little drop-like pink or red spots, often pops up after a strep infection. The scale is usually thicker, more silvery. Discoid eczema, nummular eczema, coin-shaped patches, really itchy, inflamed, sometimes weepy or crusty. Secondary syphilis. Syphilis can do all sorts of weird things with skin rashes, sometimes subtle discolored patches. Got to think about it in the right context. Mycosis fungoides. Now, this is the really important one not to miss, though it's rare. It's a type of skin lymphoma. Early on, the patches can sometimes mimic benign things like Pityriasis versicolor. If patches are weird, persistent, not responding to treatment, you have to keep it in mind.
Wow. Okay, that is quite a list. So how do you sort through that? What are the key things you're looking for to really nail it as pityriasis versicolor?
You're really focusing on the details. The type of scale is often very fine, maybe only obvious if you gently scrape it. The distribution, that classic trunk, neck, upper arms pattern, the variety of colors, hence versicolor, and often, crucially, the lack of significant itch compared to, say, eczema or ringworm. That overall picture is usually your biggest clue.
Makes sense. And thinking about how common this is, the epidemiology, where does it fit globally?
Yeah, it tells a story. So exact UK figures are a bit fuzzy, but generally in temperate places, it's thought to affect less than 1% of people. But then you go to hot, humid tropical regions and bam, it can affect up to 40% of the population in some areas.
40%, that's huge.
It really is. That massive difference just highlights how much climate and sweating drive this condition. It's found worldwide, but it really shows itself much more in those hot, humid places. And like we said, usually kicks off after puberty, peaks in young adulthood, matching up with that increased skin oiliness.
Okay. So someone comes in, you suspect it based on the look and the story. How do you actually confirm it? Do you always need tests? Let's talk investigations.
Often. Honestly, the diagnosis is clinical, based on that characteristic appearance we've been talking about. An experienced GP or dermatologist might just recognize it straight away. But if it's not quite typical, or maybe treatment isn't working as expected, then yeah, investigations can be really helpful.
And what investigations are we talking about?
The main one, the classic one, is a skin scraping. You gently scrape a bit of scale off a patch, put it on a microscope slide with some potassium hydroxide KOH solution, and have a look under the microscope.
And this is where that famous description comes in, right?
Exactly. This is where you're looking for the classic spaghetti and meatballs appearance. The spaghetti are the short, stubby fungal filaments, the hyphae, and the meatballs are the clusters of round yeast spores. Seeing that pattern is pretty diagnostic for a Malassezia infection causing the rash.
Spaghetti and meatballs. Okay, that's a great visual to remember for exams. Anything else?
Well, sometimes a Woods light that's a type of UV lamp can be used. Affected areas might show up with a yellowish or a greenish fluorescence. It's caused by a substance the yeast produces. Fungal culture usually isn't needed because, remember, Malassezia is normal skin flora. So just growing it doesn't prove it's causing the problem. Seeing the actual fungal structures, the spaghetti and meatballs on microscopy, is much more telling.
Right. Microscopy is key if you need confirmation. Spaghetti and meatballs. Got it. Okay, so we've diagnosed it. How do we actually treat it? Management.
Good news is, It usually responds well to treatment. We use antifungal medications, and the first approach is typically topical antifungals.
Like what specifically?
The most common and effective ones are things like ketoconazole or selenium sulfide, usually in the form of shampoos or sometimes creams. Ketoconazole shampoo is probably the most widely used, especially if the patches are widespread in the trunk, because it's easy to apply over a large area in the shower. Selenium sulfide shampoo is a good alternative. For smaller localized areas, or maybe during pregnancy where you might want to avoid shampoo sometimes, antifungal creams can be used too.
And how do you use them? Just once?
No, typically they're used daily for a set period. Often it's for about 1 to 4 weeks. Depends on the specific product and how bad the rash is. For the shampoos used as a treatment, the instructions are usually to lather it up, leave it on the skin for maybe 5 or 10 minutes, and then rinse it off thoroughly.
Okay. And what if the topicals just don't cut it? Or if it's a really, really extensive case?
Yeah, so for more severe cases, or if it's really widespread or keeps coming back despite good topical treatment, then oral antifungal medications might be considered. Something like itraconazole could be prescribed by a doctor.
Right. And once it's treated,
Mm.
is that the end of it? Or does it intend to come back?
This is a really important point for managing expectations. Treatment is usually very effective at clearing the active infection. However, Pityriasis Versicolor is well known for being recurrent, especially if those predisposing factors, like living in a warm climate or sweating a lot, are still present. So preventing recurrence is actually a big part of management. This might involve simple things like good skin hygiene, trying to minimize excessive sweating, wearing looser clothing, and sometimes preventative use of the antifungal shampoos is recommended, maybe using ketoconazole shampoo once or twice a month, particularly leading into or during the warmer months, can help keep it at bay. For people who get really frequent bothersome recurrences, sometimes the specialist might even consider a low-dose oral antifungal taken monthly, but that's usually a specialist decision.
Okay, so key points for revision. Topical first, think ketoconazole or selenium shampoo. Oral if it's severe, widespread, or resistant. And recurrence is common, so think about prevention.
Exactly. And thinking about that, let's picture a typical scenario. Say a 17-year-old student comes in, it's summer, they've noticed these patches on their chest and back that look lighter than their tan, they're a bit scaly on close inspection. You suspect Pityriasis Versicolor. Based on what we've discussed, what's the most appropriate initial treatment you'd suggest?
Okay. Given the location trunk, large area, and the likely diagnosis, I'd probably reach for the ketoconazole shampoo first. Easy to cover the area, and it's effective.
Spot on. Hits the yeast over large areas efficiently. Now, here's another crucial point about the outcome of treatment. The skin color takes time to get back to normal. The antifungal kills the yeast, sure, but the melanocytes need time to recover and start producing melanin properly again in those areas.
So even when the fungus is gone, those white patches might hang around for a bit?
Yes, absolutely. That's really important to explain to patients. The patches aren't actively infected anymore, but the hypopigmentation can last for weeks, sometimes even months. It gradually gets better as the skin gets some sun exposure and starts to tan evenly again. This pigment change is often the main thing that bothers people. A good way to tell if the infection itself is cleared is if the patches are no longer scaly when you gently scratch them. If the scale is gone, the fungus is likely gone, even if the color hasn't returned yet.
That makes sense. Which leads us nicely to the overall outlook of prognosis. What's the typical journey once it's treated?
It's generally seen as a chronic and recurrent condition. Like we said, easily treated, but recurrence is common, especially if you're in the right environment for it or prone to it. But the prognosis in terms of general health is excellent. It's really just a cosmetic issue. It's not dangerous or harmful to overall health.
And the color coming back.
For the pink or brownish types, the color usually fades relatively quickly after treatment. For the white, hypopigmented type, it just takes longer for the pigment to normalize. The skin should eventually get back its ability to tan normally in those areas, letting the patches blend back in. Although it's worth mentioning, very rarely, if it's been there untreated for a very long time, the white marks can sometimes be permanent, but that's definitely not the usual outcome.
Okay, so stepping back then, are there any significant problems or complications we need to worry about with Pityriasis Versicolor?
Fortunately, serious complications are really rare. The main issue, as we've discussed, is that persistent hypopigmentation after the infection is treated, which is primarily a cosmetic concern. It can cause some distress for people, especially as it often becomes more noticeable after sun exposure when they might be wearing less clothing.
So no risk of it like spreading inside the body or causing systemic illness.
No, not with Pityriasis Versicolor itself. It stays superficial, on the skin. The main challenge really is managing expectations about the color returning to normal and that high chance of it coming back.
That was a really thorough deep dive into Pityriasis versicolor. We've gone from the tiny yeast causing it right through to treatment and what to expect long term. Hopefully this really helps cement this topic for your revision.
Yeah, just remember those key takeaways. It's a Malassezia yeast overgrowth, often triggered by heat and humidity. If you need confirmation, look for spaghetti and meatballs on microscopy. Treat it topically first, usually with ketoconazole or selenium sulfide shampoo. It often comes back, so think prevention. And crucially, be patient with the color returning. It takes time after the infection's gone.
You have successfully navigated this deep dive.
For more free MSRA revision resources, do visit freemsra.com. And for the full premium revision toolkit, you can head over to pastthemsra.com.